Medicare can be quite confusing. You have different parts of Medicare. You have your different options. So in today's video, we're going to get the confusion and we're going to talk about Medicare Supplement Plan N. We're going to give you the truth when it comes to a Medicare Supplement Plan N. So that way it can kind of help you decide, do you want a Medicare Supplement Plan N, maybe a Plan G? But in today's video, we're going to focus on Medicare Supplement Plan N. Before we can even talk about a Medicare supplement, we need to talk about Original Medicare. Why do you need a Medicare Supplement Plan in the first place? So Original Medicare has several parts. You have your Medicare Part A, which is your hospital coverage. It also covers home health. It covers hospice, and it covers skilled nursing home care as well, right? If you want to remember what is Medicare Part A, remember the letter H: hospital, home health, hospice, and skilled nursing home care. Okay, now let's talk about Medicare Part B. Medicare Part B is your medical coverage. It's going to help with things outside of the hospital, like outpatient. So your doctor visits, your x-rays, your labs, your diagnostic procedures, your durable medical equipment, your mental health, things like that is going to be covered under Medicare Part B. However, Original Medicare only covers 80%, leaving you behind 20%. So that's why it's very important to decide if you want to get on a Medicare Advantage plan or a Medicare supplement that actually covers that 20%. When it comes to a Medicare supplement plan, also known as a Medigap plan, hint word Medigap because it fills in the gap that Medicare does not cover, which is the 20%, right? So yeah, that's why you will want to go ahead and enroll in a Medicare supplement plan, because the 20% don't have a gap. It's not like it's a max out of pocket, right? So it could be 20% of whatever the bill is, and 20% could be a lot, especially if you have a medical emergency and you end up in the hospital for days or weeks or even months. That can happen, and it does happen, right? So you definitely want to protect yourself from a emergency when it comes to your medical health. So in today's video, we're going to break it all down, why individuals would choose a Medicare Supplement Plan N versus a Medicare Supplement Plan G, okay? Usually it's because the monthly premium for a Medicare Supplement Plan N will be cheaper than a Medicare Supplement Plan G, because Medicare Supplement Plan G covers pretty much everything but your Part B deductible. With a Plan N, there is some copays, and we're going to break all of that in today's video. So let's get right into it. So I have my chart here that explains what a Medicare supplement is, which is it follows Original Medicare. It covers the 20% that Original Medicare covers, right? So if Original Medicare says this is a service that is already provided, then you don't have to go through pre-authorization when it comes to a Medicare supplement plan. So if Medicare says yes, then your supplement will follow and pay the 20% of the bill. And also, if your doctor takes Original Medicare, your doctor will also take your Medicare supplement, which is really nice, meaning that you could go to any doctor that takes Original Medicare. You could travel with your supplement as well. You could be in New York for 6 months. You could be chilling in Florida for the other 6 months. And you don't have to worry about, will my doctor take this insurance? As long as your doctor takes Original Medicare, they will also take your Medicare supplements. And like I said before, if it's a service that Original Medicare already covers, then the supplement will follow and pay the 20%. So that means you don't have to worry about pre-authorization. You know, with traditional health insurance, sometimes you do have to get pre-authorization, asking for permission to get a certain procedure done, a certain test, or however. And it could also require that you do step therapy and, you know, make you go through some hoops to get the care that you need. But when it comes to a Medicare supplement plan, you don't have to go through those hoops as long as it's a service that Original Medicare provides, okay? So that is a plus why individuals go with a supplement plan. So let's just talk about the pros really quick. I said a few already. You can travel with it. You can go to any doctor that takes Original Medicare. And when I say travel, I mean within the US. You don't have to worry about pre-authorization, but of course there is a cost when it comes to having a supplement plan. So you're going to pay an additional monthly premium when it comes to a Medicare supplement. So you're going to pay your Part A, which is usually $0 when it comes to your Part A premium. You're going to pay your Part B premium. You're also going to pay for the monthly supplement premium as well. And you also need a drug plan. Even if you're not taking any medications, you do need to have a drug plan as well. It can be a little costly depending on where you live, but it is worth it. It's going to be based on your age. It's going to be based on the location you live. And if you have to go through underwriting, okay? So is a Medicare supplement plan worth it? Yes, because you have the freedom to choose any doctor that takes Original Medicare as long as that doctor is taking new patients. Let's dive in a little deep on what the supplement actually covers and what it don't cover. So first, let's start with what Medicare Supplement Plan N does not cover. So it does not cover your Part B deductible. So Medicare comes out with a Part B deductible each year, usually under $300 for the year, which is not bad. So you do have to pay your deductible. Once you meet the deductible, then the supplement will kick in and pay that 20%, okay? Also, with a Medicare Supplement Plan N, it does not cover excess charges. So what are excess charges? So the doctor can actually charge you more than what Original Medicare charges, right? Up to 15% more. However, not all states allow this. Some states, doctors cannot charge excess charges. So that is good to know. And some doctors don't charge excess charges anyways, but it's very important to know that it can happen. Doctors can charge excess charges, and with the Medicare Supplement Plan N, you are responsible for that. It does not cover excess charges. Also, with a Medicare Supplement Plan N, there are some co-pays up to $50 to see the ER. Like if you had an ER visit, it would be up to $50 copay and up to $20 for your doctor visits, okay? So that is why some individuals will go with a Medicare Supplement Plan G, because there's no copays with the Plan G, and Plan G does cover excess charges. Please take a moment to like this video. Give it a big thumbs up if you are enjoying the content. It really helps others to find this video, and it helps the channel a lot. Thank you so much. Moving along. Now let's talk about what the Medicare Supplement Plan will cover. So let's get to the computer and look at this chart here. Okay, so your Part A coinsurance and hospital coverage, your Medicare Supplement Plan N will cover this at 100%. So like I said, Medicare will pay their portion, and the supplement will follow. Your Medicare Part B coinsurance and copayment, we kind of touched base on this. When it comes to doctor visits, it's up to $20 copay, and when it comes to ER visit, it is up to a $50 copay. Your blood, so the first 3 pints of blood, your Medicare Supplement Plan N will cover this. Your Part A hospice care coinsurance or copayment, your Medicare Supplement Plan N will also cover this as well. Skilled nursing facility coinsurance. Now this is very important because this could be very pricey. The first 20 days, skilled nursing is $0, but after that it can be quite expensive, around $200 or so per day. And your Medicare Supplement Plan N covers this. Your Part A deductible is also covered with Medicare Supplement Plan N. Now let's talk about the Medicare Part B deductible. Your Part B deductible is not covered, which I have mentioned before. it's not covered under Plan N or Plan G. Your Medicare Part B excess charges is not covered as well. We talked about this. The doctor can charge up to 15% excess charges, and with a Medicare Supplement Plan N, this is not covered, so you will have to pay those excess charges. And now let's talk about foreign travel for emergency. There are some limits, but yes, so your Medicare Supplement Plan N does cover foreign travel as well. Okay, so let's talk about the cost really quick. I kind of touched base on this a little bit, but I do want to talk about it a little further. Like I said, it's going to be based on your zip code, it's going to be based on your age, and it's going to be based on, do you have to go through underwriting, okay? Alrighty, so we're going to talk about some underwriting questions that you may have on your application. Now remember, this is based on individual health insurance carriers that supplies the Medicare supplement plans. So depending on your health condition, then you may be able to get on a Medicare supplement plan or not, okay? So here are some of the questions, not all, but some. It asks you here, were you hospitalized as an inpatient overnight, not including observation, within the past 90 days, 3 or more times within the past 2 years? Are you confined to a bed receiving home health care or currently being treated or living in any type of nursing facility other than an assisted living facility? Within the past 2 years, did you receive IV infusions or injections for primary immunodeficiency syndrome? Has a licensed medical professional ever diagnosed you with end-stage renal disease or advised you that you may require dialysis? Some other questions that you want to be aware of is diabetes with complications, dementia, Parkinson's, heart conditions, cancer, heart attack, stroke. So if you say yes to any of these questions, most likely you will not be able to pass underwriting if you're after your initial enrollment period, meaning that the first 6 months you turn 65, you can get on a Medicare supplement plan without any questions, okay? Also, if you decide to delay Medicare Part B due to working, when you retire, you will have the opportunity to get on a Medicare supplement plan without any health questions, okay? But after your enrollment window closes, then you will have to go through underwriting. And like I said, if you say yes to any of these questions, then most likely you will not be able to get on a Medicare supplement plan. Also, it depends on the insurance carrier when it comes to the underwriting. They all ask their own questions. So yeah, it just depends on your health condition if you do in fact have to go through underwriting. It's very important to talk to a broker that understands the market when it comes to shopping around for a Medicare supplement plan. It could help you when it comes to costs in the future. You never want to get on a Medicare supplement plan because it's very low in price. You want to research that company to make sure that their rate increases and their rate history is nice and steady in the market, and they have a good market share when it comes to Medicare supplement enrollees, okay? So it's very important to work with a broker that you trust, that understand the supplement plans in your area, so that way you get yourself a good rate in the beginning and a good steady increased rate in the future as well. Because like I said, if for some reason you on a supplement plan that's very pricey, say they start you off at a very low rate, but they jack up the rate as you age and you can't no longer afford it, you may have to go through underwriting, go ahead and switch that Medicare supplement plan. And if you can't pass underwriting, then you're kind of stuck on that Medicare supplement plan. So it's very important to shop around with a broker that you trust versus calling each different insurance carrier, asking them their different rates. It could be very confusing calling so many different companies and bouncing around. But when you talk to a broker, they should have all of those rates, okay? So yeah, it's very important to really do your research when it comes to shopping around for a Medicare supplement plan. Now let's talk about the actual cost. Like I said, it depends on your age. Do you have to go through underwriting in the area you live in? Depending on the state, Florida supplements can be a little pricey just because there's so many retirees here in Florida. So it can be a little pricey here in Florida. However, the supplement plan N is cheaper than a supplement plan G because you do have those copays and excess charges. So I'll say the average cost for a Medicare supplement plan N for someone turning 65, and I'm adding part B, I'm adding your drug plan as well, the supplement plan. So here in Florida, I'll say around roughly $400, give and take. In other parts of the world, I would say at least $100 cheaper. Like I said, Florida can be a little bit expensive when it comes to Medicare supplement plans because, yeah, a lot of individuals retire right here in Florida. So yeah, that is the truth, the whole truth when it comes to Medicare supplement plans and everything you need to know about a Medicare supplement plan N. See you on the next video. Thank you so much for watching today's video. I hope you learned something new today. If you like the video, please give it a like. And if you know anyone that needs this information, please share this video. If you have any questions, leave them in the comment section below and I'll be more than happy to answer your question. If you need any assistance, give our office a call. We'll be more than happy to assist you. At the end of today's video, there are 2 videos that you can also watch. Thank you so much for watching. Please subscribe to see me again, and I'll see you on the next video. Thanks for watching. Bye.